Good afternoon, everyone. My name is Aaryan Midha. I'm a current second-year undergraduate student at the University of Southern California, and today I'll be presenting on social network dynamics and smoking cessation among sexual and gender minority individuals. First of all, I'd like to thank my project assistant, Lucy Schuler, who's also an incoming PhD student at USC, so quick shout out to her. I'd also like to thank my co-investigators, Dr. Matthew Kirkpatrick and Dr. Raina Peng, who were the co-investigators of this study and helped me with the data analysis. So before we get more into the study itself, I wanted to provide some context on what disparities SGM individuals experience. So studies have consistently shown that sexual and gender minority individuals defined as SGM consistently experience higher smoking rates compared to their heterosexual counterparts, which can lead to increased risks of tobacco-related diseases, such as cancer and even cardiovascular disorders. Additionally, they may often face psychological and social challenges that can include social stigma, discrimination, and even minority stress, all of which can lead to higher levels of psychological distress and coping behavior, such as smoking. SGM individuals use the smoking as often a means of coping with the stress associated with, for example, coming out, navigating their relationships, and dealing with societal marginalization. These factors not only increase the likelihood of initiating smoking, but might also make quitting more challenging due to the complex interplay of psychological, social, and environmental factors. Now, traditionally, I'd say overall, like smoking has traditionally focused on individual behavior. However, recent research has highlighted the importance of considering the social context surrounding behavior. So in general, I'd say social networks exert a significant influence on health behaviors, including smoking through various mechanisms such as social support, social norms, and social influence. Within SGM communities in particular, social networks can play a crucial role in shaping individuals' behavior outcome and smoking outcome through cessation efforts. For example, they might be more likely to smoke if their social network consists predominantly of smokers, or if they perceive smoking as a normative behavior within their community. But conversely, supportive social networks can facilitate smoking cessation by providing encouragement, accountability, and resources to quit. So kind of understanding these dynamics can be very effective and essential for designing interventions that not only leverage social support systems, but also allow individual behavior combined to promote smoking cessation among these individuals. So in terms of our study, we aim to assess how social network characteristics in particular can influence these changes in smoking behavior between social networks and smoking habits. And by examining these two things, we could potentially gain insights into potential pathways for smoking cessation. Secondly, we aim to kind of address specific network characteristics or dynamics that predict successful smoking cessation outcomes among these individuals. And by understanding like the nuances of social connections, we can tailor our interventions to better support individuals on their quit journey. So in terms of our study design, we utilize a longitudinal study design that examined changes in social networks, dynamics, and their behavior among SGM individuals. So participants first completed a baseline survey which analyzed their social network characteristics, which is their 10 closest relationships in their network. Then they went through a series of ecological momentary assessment for 35 days, during which on the 7th day, they started their quit attempt. And then a time length follow-back method was implemented at the 3-month follow-up, which not only reassessed their social network, but also looked at the number of cigarettes they had smoked in the past 30 days as an indicator of their smoking status. And in general, this approach kind of allowed us to assess like their smoking dynamics over time and like their potential relationship with their network to smoking cessation outcomes. So in terms of our sample characteristics, our sample consisted of 79 individuals that were mostly female and diverse, but with a predominantly white demographic makeup. This secondary analysis allowed us to kind of focus on the subset of participants from the main study and also provide valuable insights into smoking behavior in SGM communities in regards to their social context. In terms of our questionnaire, as you can see, we were kind of asking their 10 closest relationships, and most commonly people would also say like, in terms of like their relationship, were they their spouse, was it someone in their family? These are some examples of relationships they might indicate. And in addition to that, we asked if they were also smoked. And this kind of allowed us to measure the level of interconnectedness within their network, defined as homophily, as well as shared smoking status, which is more density. And this is an example of what the social network can look like. So the black circles represent those that smoke, with the ego being at the center, or the individual. And in general, to assess homophily, we looked at the number of smokers in their network divided by the total number of people. And the same can be said for density by looking at the ties instead. And for every network that we analyzed, we were able to determine these numbers. So in terms of data analysis, we wanted to look at whether the network of SGM individuals kind of changes from the quit attempt all the way to the follow-up. And secondly, we wanted to see if these network characteristics are related to smoking behavior in particular. And so by kind of addressing these questions, we wanted to better understand the role of social networks in smoking cessation outcomes. Now let's take a closer look at the graphs. So in this graph in particular, we observe a significant time and smoking status interaction, which indicates a decrease in the proportion of smokers within participants' networks for abstinent individuals. This suggests that successful quitting is associated with a reduced presence in one's social network, and changes in one's social network were primarily driven from individuals who abstained from smoking at follow-up, so primarily for those who were able to quit. And by examining these changes, we were kind of able to identify some patterns of smoking influence in terms of social influence that may influence cessation in the future. Additionally, we found a main effect of smoking on network density, which suggests that individuals with higher baseline network density were more likely to quit smoking. And overall, this kind of could highlight the potential role of social network interconnectedness and smoking cessation outcomes, as there was a slight decrease in the proportion of smokers within participants' social networks from baseline to follow-up. Overall, we'd say that since there was not a significant decrease in density, it might suggest that participants may have also adapted their social networks in some form that we still need to explore in regards to improving the smoking cessation efforts without reducing the overall interconnectedness of their system. And these preliminary findings kind of highlight the resilience and adaptability of social networks to kind of facilitate smoking cessations among SGM individuals. So overall, we'd say that successful smoking cessation was correlated with a reduced presence of smoking individuals in the network, which could highlight the importance of social support for non-smokers in particular during their quit attempts. This can underscore the potential role of networks in promoting smoking cessation among individuals, and also highlights the need for more effective interventions that address the social environments of an individual. And thank you so much.